Hi, my name is Maziar Shadman. I'm from Fred Hutchinson University of Washington in Seattle. On behalf of my co-investigators and the study team, it's my pleasure to present the data on Enitociclib or VIP152, which is a selective and clinically active CDK9 inhibitor. And here we present the primary safety and efficacy data on non-Hodgkin lymphoma and chronic lymphocytic leukemia. Enitociclib targets positive transcription elongation factor B pathway by inhibiting CDK9-dependent RNA polymerase II transcription. This causes a rapid depletion of short half-life messenger RNAs, such as driver oncogenes like MYC and MCL1. This downregulation delivers oncogenic shock and cell death. In collaboration with investigators in the US and in Spain, Enitociclib is currently used in 2 clinical trials. The study 101 has completed its monotherapy dose escalation and enrolled 16 patients with non-Hodgkin lymphoma. The study 102 is currently enrolling patients with relapsed refractory CLL or Richter syndrome. In this presentation, we also included results from the first 4 CLL patients treated on the 102 study. Here we see the baseline characteristics of the patient. The combined lymphoma and CLL data is pulled together in the table on the left side. As you see, the patients are heavily pretreated, and 13 of the 20 patients had at least 3 prior lines of therapy. You see that 35% of patients had bulky disease defined by 7.5 centimeter mass or larger. And also for the 4 CLL patients, the patients had high-risk disease defined by deletion 17p in 4 out of 4 patients. And in 3 patients who were tested for TP53 mutation, they were all mutated. And the patients who had information on IGHV mutational status, 3 out of 3 had unmutated IGHV mutation, which is associated with poor prognosis in CLL. The range of prior therapies for CLL patients was 6 to 11 in the patients that were enrolled so far in the CLL cohort. Here's the pooled safety analysis. Neutropenia and grade 1 and 2 GI toxicities were the most common. 3 subjects were managed with growth factor support at the discretion of the PI. And so far, there has not been any discontinuation of the drug or deaths due to enitociclib on the study. And the details of the toxicities are listed, divided by different grades from 1 to 4, as shown here in the table from the 20 patients, again, from the combined non-Hodgkin lymphoma and CLL studies. Here we updated the treatment duration and clinical efficacy results. As shown previously, 2 patients with double-hit large cell lymphoma had complete metabolic response. And of the newly enrolled patients in the NHL study, 1 patient with transformed follicular lymphoma has a stable disease and currently in cycle 7 with 22% reduction of the tumor burden. Of note, this is a similar pattern, similar to the first 2 responders, and patient continues on therapy at this time. The first 2 patients with CLL received a lower dose level to establish safety. These patients received 10 milligrams for the first dose and 15 milligrams for subsequent doses. Both patients had progressive disease, and we're now using 15 milligrams for the first dose and 30 milligrams for subsequent doses, with 1 patient on the study and more in a screening at this dose level. We've shown previously the pharmacodynamic of the drug and the downregulation of the MYC and MCL1 in the blood of patients treated with enitociclib. Here we show this data in the blood sample for a CLL patient who received a lower dose, again 10 milligram. And here we see that there's not robust enough downregulation of the MYC compared to what was observed at 30 milligram enitociclib previously. And we also have the same pattern with MCL1 as well. So in summary, preliminary PD data suggests that 10 and then 15 milligram dose is not robust enough to deliver adequate downregulation of oncogenic signals. And this is supported by lack of response that we observed with the first 2 CLL patients who received the 10 milligrams followed by 15 milligram dose. We also we've also seen that monotherapy with enitociclib has shown clinical activity in the double hit lymphoma, and with longer follow-up, perhaps in other B-cell malignancies. And again, one patient with transformed follicular lymphoma is currently in the study after 7 cycles with 22% reduction of the tumor burden. So enitociclib is now granted orphan drug designation for treatment of double hit lymphoma from the US FDA and also EMA. And enitociclib monotherapy has a favorable safety profile consistent with previously reported safety results across the range of B-cell malignancies. The favorable safety profile of enitociclib makes it a good combination partner. As such, enitociclib is being evaluated in combination with BTK inhibitors as well as with combination of venetoclax and prednisone. Thank you very much for your attention.